I want to welcome you to our website, and specifically the section on chronic pain. I also want to congratulate you for being here. The fact that you are listening to me right now means you are actively looking for a solution to your chronic condition. I want you to know that you are not alone. Chronic pain affects over 100 million people in the United States. In our office, we see many people with chronic pain, either due to trauma, which can be physical and or emotional, sciatica, neuropathy, carpal tunnel, failed back surgery, chronic neck or back pain, rheumatoid arthritis, and fibromyalgia. What I have found over the years is my patients really want the answers to two basic questions. Why do I have this condition, and what can be done to restore my health? The answers, which has never really been explained to you, is that the signal or the wiring from the brain to the spinal cord has been disrupted. Within our bodies, we have excitatory pathways and inhibitory pathways, or a gas and a brake pedal. The brake pedal is not specifically working properly, and data being interpreted by the brain, primarily in the parietal lobe, is not functioning properly. Standard medical treatment offers medications to decrease pain levels, spinal stimulators to alter the pain signal, physical therapy to strengthen the area, and injections such as nerve block or epidural steroid injections. The outcomes of this treatment protocol overall decreases the pain. However, generally, medication has to continue to be increased, resulting in addiction. There can also be depression, disability, insomnia, and of course, other health-related issues generally will arise. If I asked you to name me 4 things that would help you get your life back and help with the chronic pain, would one of your answers be medication? The physical and emotional stress from chronic pain can be overwhelming, which ultimately leads to a vicious cycle, making it difficult to change. Initially, the adrenal glands will react to the stress response and release cortisol, which is your body's natural fight or flight mechanism. Over time, however, cortisol is not our friend and can lead to inflammation in the brain and or body. It has been proven it can lead to a leaky gut situation by damaging and thinning the mucosa of the gut lining. This can lead to digestive issues, brain fog, joint pain, insomnia, and at times autoimmunity. This next part is the most important part, so I want you to listen carefully. It is what your doctor has failed to explain to you the reason why you have chronic pain. All chronic health conditions have some common threads. There has to be an underlying component such as diabetes, anemia, autoimmunity, medication side effects, and there are several others. This ultimately causes a neurological imbalance, causing a decreased firing of the brain and nervous system, and fatigue and degeneration can set in. In our office, we always see a combination of neurologic and metabolic problems, and the ratio is slightly different for everyone. Let me introduce myself. My name is Dr. Michael Veselak. I've been a chiropractic physician for over 30 years, and I'm board certified in integrated medicine and a certified functional medicine practitioner. For many years, I suffered with chronic back and knee pain following a knee surgery 20 years ago. Every day of my life since the surgery, I had swelling in my knee and difficulty with my usual activities. I thought that surgery just didn't go perfectly, or maybe at the time I was just not focused enough on the therapy. Approximately 7 years ago, the pain was so intense I had difficulty walking from my office to my car. It was at this point that I decided I needed a different approach. This new approach focused not on my symptoms, but rather finding the cause. I began to treat the whole body, focusing on nutrition and lifestyle, changing my pain level, which was reduced in a very short time. Of course, with every patient, the reason why they're experiencing the ongoing pain and inflammation is different. We must find the underlying cause, control inflammation, remove the cause or the antigen, provide dietary and nutrient support, and provide lifestyle changes. Around the same time frame, I was introduced to 3 new therapies that also revolutionized the way I practice. The first was spinal decompression. This allowed me the ability to safely and effectively take pressure off of the spinal nerves and increase the disc height and nerve opening. The second therapy was nerve regeneration therapy. We utilized the Hako Med, which is a microcurrent, to help stimulate peripheral nerves and reduce overall inflammation. The third therapy was cold laser. This also has proven to go into the nerve cells and stimulate energy, allowing the neuron to heal. It will also stimulate microcirculation and lymphatic drainage. For any nerve or neuron to repair and become revitalized, it requires fuel and activation. Fuel in the form of glucose and oxygen, and we must eliminate inflammation. If you have chronic inflammation, the body will be unable to repair itself. There are a lot of causes of inflammation that contribute to chronic pain. Food sensitivities, hidden gut infections, high insulin levels, hormone imbalance, poor diet, to name a few. We oftentimes need to do proper testing to figure out the root cause. We'll do basic lab panels, adrenal saliva testing, looking for cortisol imbalance, stool testing for gut infections, genetic testing through 23andMe, heavy metal testing, and food sensitivity. Activation is the other important part to have the body and nerve repair itself. We recommend specific exercises directed to the brain, spinal cord, joints, and muscles to affect the neuroplastic behavior. I have a passion for helping people with chronic pain and literally change their life. I am going to save you a lot of time and money going from doctor to doctor looking for relief. Some key points that I want you to understand: it takes many different things to correct the problem. There is no magic bullet. You must address not only the structural, but the neurologic and metabolic problems to have success. We are the most comprehensive state-of-the-art facility in Ventura County. I'm sure you've tried several things in the past and you are thinking, this is something you've already tried. I understand how you feel. I have a lot of patients that have felt the same way. What I found is when I supported the patient structurally, metabolically, and neurologically, improvements in their pain level began to occur. So what's next? Call the office, make your appointment. Here are a few things you need to think about. On a scale of 1 to 10, how serious is your illness? Where do you see yourself in 3 years? Has it affected your relationships, your work, your ability to enjoy life? What 3 things would you do if you did not have chronic pain? On a scale of 1 to 10, how serious are you about eliminating this pain? I have a very busy office, and I want to work with people that are truly committed to getting healthy. If you are not quite ready to make a change, then please do not make an appointment at this time. I am often asked, does insurance cover the costs? Generally, insurance, as you are well aware of, does not pay for chronic care, but they will pay a small portion. Our care plans are between 4 to 6 months, dependent on the severity of your condition, and costs range from $200 to $350 per month for a period of 18 months. We look forward to assisting you in enjoying the things in life that are important to you. If you have any questions, you can email me at dr.veselak@gmail.com. Our website is drmichaelveselak.com, and our Facebook page is Camarillo Functional Health. Thank you for listening.